A professor at the University of Ottawa, Dr. Deonandan. How are you?
I'm well. How are you?
Okay, we're all concerned. I don't have a toddler, but I sure know people who do, and they're absolutely terrified these days. What's the lie of the land there in this crisis right now?
Well, I do have a toddler, and I'm also terrified. It's pretty bad, and that's understating it. Like we have a situation in Calgary right now where the hospice has been closed because there aren't enough beds for terminally ill kids. They need to reserve those beds for kids who aren't terminally ill. So that's heartbreaking. We have a situation in Ottawa where CHEO has brought in the Red Cross, like we're a disaster zone from a low-income country. We have no ICU beds for pediatric care across Ontario, negative beds actually, which means kids are being doubled up to a large extent. We have the ongoing crisis in healthcare workers, so we don't have enough people to staff what limited capacity there is. We have wait times if you show up to the ER of anywhere from 7 to 40 hours in some cases before you get treatment. 40 hours. That's insane. So my my overall concern, not just of the ongoing crisis, is people don't seem to understand that there's a crisis. You talk to random people on the street, they don't know this is happening. So there's been a communications failure as well, and therefore a slowness in willing to enact policies and behaviors to slow this process.
So is that what you think? I mean, it's true. I mean, if people are glued to the news or they have kids, they know, but not everybody knows. What can break this? What has to be done?
I think there has to be a concerted effort among everyone who communicates for a living. That includes you and me, media in general, to make this a front page story every single day. To take cameras into hospitals, frankly, to show them just how bad it is. There's a counter narrative amongst minimizers saying this is all made up. Believe it or not, it's not made up. And so that's what's this is a supply and demand problem, as I've been saying for a while. There's insufficient healthcare supply to meet growing healthcare demand. And most of the policy directives so far have been aimed at increasing supply. That takes years, getting more nurses in, building more beds, etc. And it won't be enough, even if it were possible. We've got to slow demand, and that means changing behavior in the short term. That means indoor masking. If you're in a public indoor setting, it means making choices to minimize your exposures, not just people with toddlers, but anyone who might come into contact with somebody who might come into contact with a toddler. So we're missing an education piece for the public around the nature of the crisis and also around what we can do to slow the crisis.
We all know that navigating any kind of a gathering now, there's the people who mask and there's the people who don't. But the fact that this is hitting toddlers and children, do you think that may change? Or is this such a strong feeling among those who mask and those who don't? Has it been embedded, or do you think there's hope as we head into this holiday season?
I'm always an optimist. This is the first time I'm not very optimistic around human behavior. We thought early in the pandemic that because COVID was hitting the elderly and people were willing to do what it took to protect the elderly, that if this were hitting children, they'd do even more. Well, now it's hitting children and people aren't willing to do more, and that's disappointing. I think a big part of the problem is the power and reach of disinformation merchants who have pushed this narrative that masks got us into this situation. It is not what got us into this situation. There's a fake pseudoscience term called immunity debt floating around that suggests that the pandemic restrictions of the last 2 years is what got us here. No, that is not the case. So we have to disentangle the politics and pseudoscience from the messaging and to explain to people that this is an unusual situation of unprecedented infection amongst our children. The only option on the table to stop this is for everyone to choose behaviors that slow transmission. And that means wearing a mask when you can and avoiding social gatherings if you've got symptoms, getting vaccinated against the flu and COVID, especially if you've got kids, get them vaccinated if they're eligible. Do what you can to protect young children.
How effective are masks? This comes up. I mean, you talk about information that's out there, but how could they affect this? What's happening with the flu and these viruses
Yeah,
right now?
there's a lot of misinformation about masks. Masks are extremely effective. Look, there's one CDC study that showed that if you wear a mask, you have an 83% lesser odds of getting COVID, for example. Masks have repeatedly been shown in a variety of studies to protect the wearer and people from the wearer. Now, there are controversial studies showing the amount of transmission in the community reduced by mask wearing can vary. And there's one famous study in Bangladesh showing it reduced symptoms by 11.6%, which doesn't sound like a lot. That's only after a 29% increase in mask wearing. That's it. That decreased symptoms by up to 12%. That's extraordinarily high. So the bottom line is the evidence is pretty clear in my mind. Masks work. And they don't have to work perfectly. They just have to work well enough to slow the traffic in the hospitals for the next few weeks.
And in the next few weeks, there's going to be a lot of holiday parties. Would you recommend that? I'm going to a holiday party, a couple of them. I do
Well,
see, even a professional gathering.
I think people are going to socialize. I don't want to curtail people's social lives. Again, I have a toddler. I'm not going to be socializing. And if you don't have a toddler, I can see why you want to go to parties. But please get vaccinated. If you have symptoms of any kind of respiratory disease, don't socialize. Definitely do not expose yourself to a child. If you can, I think you should wear a mask if you're going to socialize. We can make it doesn't have to be all the time. It doesn't have to be perfectly. It just have to be most of the time in important settings. So you can socialize responsibly and limitedly. Go on walks, just like we have the last couple of years. My spouse and I were talking about this just last night. She's a doctor. It's worse this year than it was last year, and people don't realize that. And so any precautions you took last year, you should take this year as well, especially if you have small children.
That's an incredible statement. There was a sense that what we were going through was historic and that there was going to be a inflection point in that, and then things were going to get better. And now we're faced with old foes too that are joining this new one. And as you say, within the medical community, this is being viewed as much worse than last year.
It really is. And that's not because the disease is worse. We have vaccination, and that works great. It works absolutely fantastic, and you should definitely get vaccinated. It's because of the new viruses that have entered the fray, combining in an unusual way. We have this triple pandemic happening simultaneously, and also because of the broken healthcare system. We are so much worse off than we were 2 years ago in terms of healthcare capacity, and that's not getting better anytime soon. The fact that the Red Cross had to be called into CHIO, that's an indictment of our leadership and our ability to salvage our floundering healthcare system. And I can't say enough bad things about choices being made this past couple of years around how to preserve our healthcare system. So I know I sound very negative this morning, but I'm really concerned. Some kids are going to suffer unnecessarily, and some might die as a result of failures of our decision makers and of our individual behavior choices. And so we always have it in our power as individuals to stop this. That's the good news here. And we do that by making appropriate choices every single day.
Dr. Raywat Deonandan, epidemiologist, associate professor at the University of Ottawa. Thank you so much.
Thank,
Important first story today.
thank you so much.
Yeah.